No.
Hi, welcome back, viewers, to the series of interviews that we are conducting here in the couple days before our conference to be held under the sponsorship of Penn State School of International Affairs, Penn State Law, the Coalition for Peace and Ethics, and the Research Network for Law and International Affairs. Conference will be held the 17th of April. Registration is required, but it's free. We have been talking to some of the participants in the conference and some of the contributors to short little conversations to help highlight some of the issues and clearly very important issues around COVID-19, the pandemic, and international affairs. And I am delighted today to introduce you to a former student of mine who I missed terribly as a student, but they grow up. What can you do? GAO Shan, who is a Penn State SJD in 2018. He is licensed in New York and in China. He currently works for Thomson Reuters in the Midwest. He is a member of the Coalition for Peace and Ethics, and in that capacity has worked to provide guidance for Chinese immigrants in New York State in working through the issues of running a business, immigration, and the law. He's produced and distributed the legal education and guidance pamphlet, Know Your Rights, an information guide to the basics of the New York State legal system. Under my supervision, he did an excellent job on it. His academic research focuses on the dynamic interaction between law and social order through the lens of commercial activities, especially the commercial activities of multinational enterprises. His SJD thesis, which was really excellent, and I hope to get him to publish this. His SJD thesis was the evolution of China's foreign investment policy and law, and it captured the modernization of China's commercial legal system over the course of the last 3 decades. It is my great pleasure to welcome Dr. Gao. And I want to start off, we've been talking about the COVID-19 in Italy, COVID-19 in Cuba. We've been talking about the international effects of COVID-19 and the issues that it may raise, for example, for foreign students in the US, especially on the East Coast. You're in an interesting position yourself. You grew up in Wuhan, and your family is still there and indeed quite active in Wuhan. And I was wondering if you might start by talking a little bit about the situation in Wuhan.
Oh, hi, good afternoon. First of all, thank you so much for giving me this opportunities to share my input and thoughts about the development of this right now global pandemics. So back to your questions, I believe this is definitely a very unique situation for me as a Wuhaner who lives outside of Wuhan to witness the development of this net mail. And what's unique about this is that comparing with others who learned this secondhand from the news, I was actually the person who on the front line who actually I literally see the documents issued by local administrations about the first discovery of the suspected virus by the end of the December. So I first read about the virus that was end of the December. They are talking about this unknown source of the virus causing pneumonias to the people. And I mentioned this, I remember this clearly, I mentioned this to my parents. I asked them about it, and I remember clearly that my mom was actually telling me she was having a cold for more than 2 weeks and she was planning to visit a hospital. But I told her that maybe she should wait before go to the hospital because this ongoing unknown virus is going on. Maybe it's a high risk to visit a hospital. So what I'm trying to say is I'm literally the person that seeing this, how it started from beginning, from zero to becoming progressively deteriorated. So the whole situation is really, really unbelievable for me because as some people describe this, the whole virus, if you describe it as a sports event, fighting the virus like a sports event, most of the people who experience is only half watching the half of the game. But for me, I'm watching this had been started in Wuhan and spread it out to the whole nations, and then spread to the Europe, and then spread to the US, and now I'm in the US. So this is really difficult. I can say that I'm twice difficult for me to live through this.
So how did your parents react? What happened to them during the course of this thing? Were they confined to their apartments? Did they, how were their lives sort of affected by the progress both of the disease in Wuhan and by the effects of the government's measures?
Okay, excellent. So back to your questions. This is quite this is quite interesting in a way that how this was developed at first. So like I said, there was a government issued, a local government issued documents talk about existence of this virus. That's by the end of the December. And then and then that was actually in January, you know, it's the traditional Chinese Lunar New Year's. So so the government at the beginning claimed the virus is containable and the risk of human to human contagious is limited. So most people doesn't take it as seriously. A week after the circulation and the confirmation of the existence of the virus by the authorities, there were sporadic information on the internet talking about their increases of cases of people getting sick, and they go to the hospital, and the hospital starting to feel overwhelmed by it. My parents at that time was planning to visit my grandma during the national holiday season, and they were in the midst of deciding to whether to stay at home or go to visit my grandma. And that was, right now, looking back, I would say that's the beginning stage of the virus outbreak. So at that time, people are just, no one knows really what's going on, and no one understands how serious and the severity or the magnitude of the issues. So they are certainly they are in just unsure. Since just changed after the lockdown. After the lockdown, of course, it's in the middle of the New Year celebration preparations. So a lot of people just already left the city, and my parents ultimately, on my advice, they decided to stay, and they decided to stay. So at the beginning of the lockdown, everything seems pretty curious. It's in a mood of curious because people don't know what's going on. And the original lockdown was a short, as public understand, it's only lasted for a short time. And by far we know it's lasted for more than 76 days. So people just think this is temporarily, this is like a flu and it's going to pass very soon. But at the beginning, people are just like those cities on the lockdown in Europe, they are cheering or singing when they lock down. And my parents just feeling, okay, this is serious, but it's not that, they are not in the stage of realize the horror of the whole pictures. It's only after 2 weeks after 2 weeks of the lockdowns, you are beginning to read people getting sick and they are dying in an unbelievable pace. And in many reports, you are reading that people just getting sick from they going to hospitalization until death. It's only take a week. And there were lots of cases that the whole family, first the husband get sick, then the wife, then the then the father and the kids. The whole family gets sick and died. Only the kids left. So that's becoming to the lowest of low of the mood, because when those horrors beginning circulated in the public domain, and it's really challenging your basic understanding of the world. And for my parents, they are in this is something that they think it's historical. They never been through something like this. And this becoming really, really concerning for me, because I am so far away from them. And I was trying to understand this. I was trying to find ways that I think I can secure their safety. And this is in the beginning, the second week of January, and I talk to them every day on the phone, and I'm monitoring the news and the situation every day. And from what I learned during those time, it seems that this thing is spreaded very fast in a very mysterious way, and the hospital do not have enough understanding of how it is spread, how people get sick, how to treat them. Right. So the only way.
Let me ask you a question though. In the context of this, the mood and the lockdown. In most Chinese in Wuhan, like other places, live in large buildings, large apartment blocks. Were your parents able to work with other people in the building for them to help each other during this thing, or were people literally stuck just in their apartments and kind of on their own?
Oh, good question. Actually, this is reminding me to talk more details about how it happened. So the situation basically progressively deteriorated the city life. Unlike a lot of places right now in Europe or some cities in the US after lockdown, there were instances of restrictive measures. At the beginning of lockdown, there's literally not too much restrictions in the city life. The first few weeks of the lockdown, what happened is the first week after lockdown, the first shut down the inner city public transportations like subways, buses, but you can still take taxi, and you can pass through the tunnels. Soon the tunnels is closed and the ferry is closed, and then taxis stop the operations, and then the only way people getting out is use their private cars for transportations. About in the middle and late Januaries, they are having enhanced restrictions. So even private cars cannot go out unless there were government issued permit to them. And during that time, I would say it's chaotic. It's basically like everywhere else. The government would issue one kind of measurements in the morning, and in the afternoon, it would just change. That happens to the lockdown too. So I believe at the beginning of the lockdown, the government first say they're going to unlock the city after certain days, but that quickly just overruled. And my parents, what happened at the beginning stage, they can still freely to go out their apartments. They can freely drive on the road. In the middle and in the late January, they cannot go out on the street use their car unless they have a special permit issued by the government, which is for people who are in the essential business or have a special purpose, they can go. And the real more strict restrictions comes in the late February. No, not in the late February. I think in the late January and the beginning of February. So that comes that you cannot leave your gated community unless you have a special permit. So if you want to go outside your apartment complex, you need a special permit to do that.
Right. During the course of this thing, even as it got bad, was there ever any issue about the availability of food or other essentials? Were people able to procure them one way or another?
Okay, that's a good question. So at the beginning of the lockdown, what happened is a lot of people attacked the grocery store like everywhere else. They are worried that they will have or they are just going to preparing to stock their food. That happens after the lockdown, and we know right now that a lot of people actually get affected from the virus because they are rushed to the public space during that time. So at the beginning of the lockdown, there were people getting food from the grocery store. After more restricted access in and out their gated communities, the only way they can get their food is to go to their local convenience store. If there is a convenience store inside that gated community, they can go there, get their groceries. And alternatively, they sometimes order food on their cell phone, smartphone to have the food delivered to their doorsteps. But that become less and less easy to do because you have suddenly a large demand of people going to use that alternative for one thing. And for second, the options for food become less and less because in beginning from the February, the lockdown spread out to nationwide. That means a lot of produce becoming harder and harder to be shipped to the cities. So I would say it is not a serious food supply issues, but they definitely have food supply issues. And I have read reports that people complaining food delivery, they have very limited options for the produce and the food price increased. So I would say the condition is definitely lies ideal considering people under tremendous stress and anxiety. Yeah.
So as we wrap this up, and for our listeners, we have a lot more to say about Wuhan, of course.
Yes.
You'll have to stay tuned for the conference. This is just a little taste. And I was thinking we can wrap this up. Perhaps you can spend just a little bit of time, very short because we're running out of time, but
Yes.
about your sense of the differences in the way in which one experiences this pandemic from the experience that you began to understand from your parents in Wuhan in the Midwest of China, and your experiences with the pandemic in the Midwest of the US.
Oh yes, excellent question. So I would say the thing on the top of my mind is that when this virus outbreak happened in Wuhan in January, I think there are a lot of focus on China and there are a lot of reports on China. But those focus and attention on the virus is not translated into a real concern or real preparations for what could happen here in the US. And I'm not seeing people taking this as a serious health crisis, contagious health crisis. They are just as usually they consume this piece of news like unbothered event happening far, far away. They're not going to affect or directly or detrimentally affect, immediately impact life here in the U.S. I mean, the United States, what I feel is American has been quite comfortable with the development elsewhere in China and even in Europe during majority of the time in February. It is only until the beginning of the March and the US is starting to getting their attention on this. From January to March, the whole news or the public is talking about Democratic and presidential nominations. So I would say it is, unfortunately, the situation is repeating. What happened in Wuhan is repeating here in the US. I would say Americans in a lot of places, they did tremendous, excellent jobs in fighting in the back, but definitely there are some thinkings people can do about why those focus on the event not translated into a proper caution and preparations.
All right, well, thank you very, very much. You can look forward to hearing more from Dr. Gao at our conference on Friday. Thank you very much for taking time out of your day to visit with us. And for those of you who are watching the interview series, stay tuned. There'll be more coming. Thank you again, Dr. Gao. If you've got questions or other interventions, please let us know. You can communicate us through the conference website. Thank you, and we will see you again soon.
Thank you so much. You have a great day, and please keep safe.
All right.